Hello guys, my name is Anita Luanga. I'm an exercise physiologist, internist, and geriatrician. We have been talking about deep vein thrombosis and PE or pulmonary emboli. In this video, I'm going to talk a little bit more about pulmonary emboli. So you might be asking yourself, what is a pulmonary emboli? Pulmonary emboli occurs when a clot travels from another part of the body, usually the arms or the legs, and then the clot ends up in the blood vessels in the lungs. Some of the symptoms of pulmonary emboli include chest pain, shortness of breath, dizziness, coughing blood. In extreme cases, somebody might faint and or have cardiac arrest, meaning that their heart stops beating. That is generally an extreme case, but this is something we are concerned about when somebody has a large pulmonary emboli or several pulmonary emboli in their lungs. So you might be asking yourself, what causes pulmonary emboli? I talked a little bit about vein thrombosis in my previous video. You can watch that to learn more about how that is related to and can cause pulmonary emboli. In terms of treatment for pulmonary emboli, it's similar to the treatment for deep vein thrombosis. In general, an individual will get blood thinners to treat the pulmonary emboli, and the duration with which they'll take the blood thinners depends on the cause of the pulmonary emboli. In terms of pulmonary emboli that is fairly large or life-threatening, an individual will have additional tests to help their doctor determine if the pulmonary emboli is life-threatening. For example, the individual will get a CT scan of the chest, and the radiologist, that's the doctor who looks at x-rays, live x-rays and CT scans, will comment on whether there's what we call heart strain or stress on the heart. On top of that, the doctor that's examining the patient will take note of the patient's heart rate and blood pressure. If certain parameters are met, meaning the heart rate is going down and the blood pressure going down for a specific period of time, and the clot is fairly large and close to the heart, and there is stress on the heart, in this case, the patient's doctor will consider calling an interventional radiologist that does surgical procedures or almost microsurgery under live CT or live x-ray to remove the clot. That's in fairly extreme cases and very rare. The last way a pulmonary emboli or pulmonary embolism can be treated is with an IVC filter. This is a filter that is put in the blood vessels in the chest and or the stomach to prevent the clot from the arms, usually from the legs actually, from traveling up into the lungs. This is not routinely used. It's used in very rare situations. For example, if somebody is not a good candidate for blood thinners, say they just had a major surgery, they have low blood counts, and it's fairly dangerous to start them on blood thinners. In some cases, the patient's doctor may ask the radiologist to put in an IVC filter. I hope you enjoyed my series on deep vein thrombosis and pulmonary emboli. Bye-bye for now.